To the creation of a new mental health resource called Past the Pandemic. Please welcome Leslie Choi.
Hi, Anne. Thanks so much for that warm welcome. I'm so happy to be here with you all today. And let me just get started by sharing my screen and my slides with you. All good to go? Excellent. All right. So as Anne said, I'm Leslie Choi. I'm a psychiatric nurse practitioner at the Department of Psychiatry at Anschutz Medical Campus, and I'm thrilled to be here to round out the morning of presentations. I'm going to tell you today about our Past the Pandemic series in collaboration with Echo Colorado, and just to give you a sneak peek at what our series is all about, with what was really behind it and with the intention of supporting healthcare workers during the COVID pandemic. So what we know is that I want to start by telling you a little bit about what you probably already know, and that really why we started this project in the first place. So one of the first things that informed this project came from a Viewpoint article that was published in JAMA regarding these 8 listening sessions in the first couple of weeks of the pandemic. And during these sessions, the researchers heard from 69 healthcare workers and asked really 3 key questions, and we're focusing on 3 key concerns. And those were, what are healthcare professionals most concerned about? What messaging and behaviors do they need from their leaders? And what other tangible sources of support they felt would be most helpful to them? Out of that came these 5 main areas, really, that they were able to determine that they had these 5 themes of hear me, protect me, prepare me, support me, and care for me. And the authors really concluded that healthcare professionals wanted this unambiguous assurance that their organization would support them and their family, and that this included that the organization would listen to their concerns, do all that was possible to protect them and prevent them from acquiring COVID-19 infection, and assuring them that if they did become infected, the organization would support them and their family on all fronts, both medically and socially. So the key components, I realize this is a super busy slide, but what I want you to just know about this is that the goal of our series was to respond to healthcare workers and to specifically address these needs of keeping people connected and providing emotional and psychological support, addressing these primary needs of anxiety, insomnia, self-care, and support for those who are most in need. So the second informative piece that really put together our project came from Dr. Berkowitz and our small support groups at the beginning of the pandemic. And again, I know this is tiny and hard to read, but what I want you to focus on are really these big themes on the right. So while at the top of that chart, you might see that there were some feelings and concerns about economic insecurity, fear of job loss or grief and loss of coworkers or family or patients. But in fact, most people were really concerned about what you see on the right, feelings of general anxiety, changes in their working conditions and their expectations at work, feeling overwhelmed, and that an additional 30 to 40% of respondents really honed in on these other topics around loss of routines, sleep concerns, risks of exposure to themselves or their family, the feelings of social isolation, and additionally coping with having their children at home. And I'm sure that many of you can relate to a lot of these concerns. So with this information in hand and recognizing that we needed to find additional ways to support our healthcare providers during this time, the Department of Psychiatry began a number of different projects, but particularly this Past the Pandemic project is a collaboration with Echo Colorado, with the idea that we would offer healthcare providers and other staff working in healthcare settings strategies to navigate, normalize, hold space for worries and experiences during this pandemic, and hope that each session would provide some helpful, tangible tools in addition to some psychoeducation and some connection. So the foundation really comes from understanding the stress continuum, and I'm going to introduce that in just a minute, but the idea is that we'd be able to kind of manage this stress and loss and increase our capacity to prevent burnout in particular, to elevate really that connectedness and that mindfulness. So how is our series addressing those needs? I want to start by just identifying that all of those things that we just talked about, kind of this anxiety, changing routines, expectations, poor sleep, often these things are put into the realm of mental health alone. But I want you to recognize that we are increasingly understanding that these are, in fact, become physical injuries that happen with this kind of stress, and that our stress response in our biology is meant to help us handle stress, but isn't so useful when that stress becomes chronic and unremitting. And that stress injuries are a real thing, that they're common, that they are an exposure to prolonged stress, and that if we can get in and address those things sooner, that we are able to actually reverse and treat them before they become the problems we know that are existing with chronic stress: increased inflammation, sleep disruption, high blood pressure, high cholesterol, heart disease, diabetes, and even cancer. So Laura McGladrey has been one of the driving forces behind this project, and her work with the Responder Alliance has helped to provide the foundational concepts of this series, and to create this shared language around our stress and finding if we can determine better ways to be able to promote some self-reflection. So this slide I show you because it's really where they started to transform the stress continuum model, which originally came from the Marine Corps when thinking about their service members being ready to deploy. So they started to do this assessment and determining where their Marines were prior to deployments to figure out whether or not they were mission ready. And that these other states, these other kind of characteristics, really were what indicated whether or not they needed intervention. So Laura and her team modified this slightly, but allowed it to really become transferable to people in general, not just active duty service members. And going back to our objective, this is where we really begin to understand the stress continuum and start to help to figure out ways to mitigate stress before we end up with those stress injuries in that red critical area. So we talk about green choices. We talk about trending toward the green. We really start to try to create a little bit more language that's consistent with this ability to be able to check in with yourself and figure out where you are on the stress continuum and where the others around you might be too. So what do we do about this essentially? So we initially teach people to check in here and start to think about where they might be. And then what? We start to talk about instead what charges our batteries, moves us toward the green, and what depletes our batteries. So that's some of the additional kind of language, thinking about charges and depletions, and being able to better recognize some of these comments we might be making to ourselves and to others that we discovered after our first series, in terms of what we're saying. What are we saying out loud? How might we be able to check in with ourselves? And as Laura would say, am I making comments and saying things that feel like I'm somewhere in a reacting zone, or am I limoncello? Maybe as we say, this is a stress continuum. So maybe you're not in the orange or in the yellow, but maybe you're somewhere in between. Pick a color, right? So maybe you've heard yourself say some of these phrases. Maybe you've heard others around you say them. Thinking about, sincerely right now, I'd love for you to kind of check in with yourself and think about where you are on this. And when we think about healthcare providers, one of the most important issues we have to consider are these kind of depletion injuries right now, that this pandemic has been going on and we've been really drawing on that battery and taking out that charge, and that we get really worried about burnout. So we want very much to be able to help our healthcare providers trend more toward the green. So how are we doing that through our series? We're really looking at all of these different topics. So those first two sessions are foundational to the rest of them, that stress in the human machine and digging deeper and talking about the biology of stress. But then taking apart some of those things that we heard about in our groups and in other places about what's important to people and what helps to charge their batteries. So I'll give you a synopsis of these in just a minute. So we give folks a battery snapshot toward the very beginning to help them start to identify for themselves. We do a blank one and then fill this up, but this is kind of some ideas of what might charge your battery versus what might drain your battery per se. And thinking about how we continue that language and really lean into some of the elements on both sides of these to figure out how to do more of those charges and how to do less of those drains. So I'm just going to give you a quick synopsis of each one of the sessions, just to give you a sense of what we talk about, recognizing that we also try very much to respond to what our respondents what our participants are needing. So we talk a lot about, in the third session, sleep, movement, and nutrition, why sleep is important, how it impacts our stress, not just that physical kinds of components like are on that infographic there, but all of the mood components also, the irritability and the mood swings. I say sleep hygiene is for real because I'm a huge proponent of sleep hygiene, and I think that that's something that I talk about every single day on a regular basis with a lot of my clients. And then the elements of nutrition and movement and how all of that might combine and how those might inform your green choices or push you towards the green or the yellow and other areas. The next session is about staying connected. We know that human connection, relationships, and supportive conversations are just an enormous mediating factor for stress, and that remaining connected with people, especially now, and finding creative ways to connect with people is incredibly protective. So again, in terms of the relevance of how this fits into the stress continuum, we recognize that compassion breeds more compassion, that in fact, empathy is not draining, that we feel lifted up by lifting up others, and that creating connection, allowing for vulnerability and being open and authentic is a huge component of maintaining our own mental and physical health as well as that of others. The next session is about use of mindfulness practices and talking specifically about burnout, stress, and uncertainty. And this is my co-facilitator, Mandy Doria's slide. And I just want to take a moment to also reflect that we have a number of really wonderful expert presenters, including Mandy, as well as a number of other providers from our Department of Psychiatry and who are really experts in their field. And Mandy leans in a lot on this mindfulness practice and how we can help to understand the foundations of mindfulness, which I'm sure you've heard a lot, as it is a buzzword right now and something that we commonly discuss, but really learning those hands-on mindfulness tools to cope with stress and anxiety. Another of our sessions is about using, this is Scott Cypers. He talks about using your smart brain towards parenting and relationship struggles, recognizing that it's not just about individuals, and that we really need to start to be able to think about our stress levels in our relationships also, whether that's with our families or our work teams or those other people that we engage with regularly. And we've kind of been able to adapt the stress continuum to our relationships also, and thinking about how we're showing up for the important people in our lives. What are our struggles with them? Where are they on the continuum? And where does that put us in terms of our relationships? So ideally trying to identify some of those struggles and think about role modeling some of the stress management strategies, especially for our kids right now. Managing what we've lost is, something that I think really resonated with our first group. And we talk a lot about grief, and it took us a couple of months at the beginning of this pandemic to really understand the gravity of our loss in all of the forms that we have been experiencing this, recognizing that life as we knew it and know it was over, and that things were different, and that there was never going to be a going back, that we were going to have to be able to create a new normal. And that taking a step back to look at this, at the bigger picture, is important to acknowledge that and label this as grief, that we are experiencing a sense of mourning about all of the things that have changed in our lives. So we really want to be able to create some connection, normalize that experience, and talk about the ways that we know that we can effectively work with with grief, but also when we know that it's becoming something that's becoming a bigger issue that we need to get help. Our final session is about caring for ourselves in the midst of uncertainty, and uncertainty is certainly something that we've talked so much about. And this slide is really just to highlight the fact that uncertainty creates so many emotions in us, fear and anxiety, and that our emotions are a roller coaster right now, depending upon what's happening in our home lives, our work lives, elsewhere, that it's important to be able to acknowledge what's happening and how we feel. Not to create a lot of comparative suffering about, well, I'm lucky because blank and therefore I'm not allowed to feel anxious, but really starting to feel like it's okay for me to feel these things. I can't control some of those feelings. And I need to be able to actually find ways to be able to deal with them, cope with them, and find the support that I need in order to be able to get the compassion I need for both myself and for those around me. So coming back just big picture in terms of how we're supporting our healthcare workers in the pandemic, I think that it's so important to really just focus in again on what is it that we need. What we really want and what we've heard from our healthcare providers is that they want to feel that their voice is heard and that they want very much to find that those supporting them make every effort to resolve their needs and their concerns. And that in that process, they are also genuine, that they express gratitude, and that they do it in a collective approach, that we need to be able to do this as teams, that we need to be able to do this for each other, that that's what's going to help us not move towards the orange and the red. So to bring us back to just what our Past the Pandemic series goals are, it's really these primary concepts. And I want to focus most on the notion that we need to know also beyond all of the topics that I just discussed, when to recognize how and when to obtain mental health resources. So we provide at the end of every single one of our sessions a whole list of resources to provide support for particular things, but also to be able to provide folks with resources that will allow them to get the help that they need in other ways and for other mental health concerns. So our second session, just started on October 20th. It goes through December 15th. We do have one more day of open registration, and I would absolutely love to see some Northern Colorado faces on our Zoom sessions. I can, let's see if I can send Anne the link so that you can find out how to register. But I want to just wrap up by telling you that we have a lot of resources also, and we encourage you to reach out if and when you need help. These are some of the ways that we really encourage folks to be able to get in touch with mental health resources that they need, that their teams may need, or that the other people around them may need. So with that, I'm going to hand it back to Anne, and thank you again. I'm so grateful to be here today, and I hope that you all can trend toward the green a little bit more.
Outstanding. Thank you so much, Leslie. We'll definitely post links to these resources on our event site. Again, a great resource for us to all take advantage of across the state of Colorado. So thank you so much. It's time for us to bring our Healthcare in Your Future Summit to a close. Certainly appreciate that we had some challenging perspectives today. We only bring those perspectives to the table so that we can start conversations. That's the important part of healthcare in Colorado, especially in Northern Colorado, is that there isn't one position, there isn't one solution, there isn't one opinion. There are multiples, and we need to work together as a larger community in order to achieve really good things for our citizens and our businesses. We do want to take a moment to thank our sponsors once again for supporting our event. All of them are very important, but especially our gold sponsors: Anthem Blue Cross Blue Shield, Columbine Health Systems, Northern Colorado Health Sector Partnership, Old Town Media, and UC Health. Additionally, we want to thank all of our speakers today. I don't know about you, but I'm walking away with new insight and great inspiration from the things that are happening here. All the materials from today will be available on our event website. And let me bring up that slide so that you can see where that's at. That's at nocohealthcaresummit.com. We also want to make sure to encourage you to visit our exhibitor booths. Those are being brought to you by our sponsors, though they will be open from 10 a.m. to noon right here in the web portal. You can click through. Again, it's a great opportunity to connect with people that you might be interested in growing business with. It's an opportunity to win some great prizes, but more importantly, it's an opportunity to learn about things that are happening here in Northern Colorado. Thank you again for joining us today. We look forward to seeing you at our next virtual event.